Hello everyone! In the previous lesson, we learned about on-site first aid for fires and explosions involving hazardous chemicals. In this lesson, we will continue exploring on-site first aid for poisoning, asphyxiation, and burns involving hazardous chemicals. Let's begin with poisoning and asphyxiation. Poisoning and asphyxiation caused by hazardous chemicals primarily refer to accidents where toxic or harmful chemicals enter the body through inhalation, ingestion, or skin contact, leading to poisoning or suffocation. The following are the steps for on-site first aid. 1. On-site assessment and safety protection. 1. Quickly assess environmental risks. Identify the hazard source. Determine the type of chemical based on on-site labels, odors, and the state of the leaked material. If the chemical type cannot be confirmed, assume it is a highly toxic substance by default. Control the source of the leak. Shut off valves, seal leaks, or isolate the contaminated area to prevent further spread. If the leak cannot be controlled, immediately evacuate the area and establish a safety perimeter. Monitor the environment. Use a gas detector to assess oxygen levels, toxic gas concentrations, or explosive gas concentrations to ensure the site is safe before entering. 2. Ensure proper personal protection. Wear protective gear. Based on the nature of the chemical involved, select protective suits, gas masks, goggles, chemical-resistant gloves, and boot covers. Team collaboration. Enter the site in teams of at least 2. Maintain smooth communication at all times. Set up an emergency evacuation signal. 2. Casualty assessment and initial treatment. 1. Quickly assess the casualty's condition. Consciousness and breathing. Lightly tap the casualty's shoulders and call out to them. Observe the rise and fall of their chest to assess whether they are unconscious, not breathing, or breathing weakly. Poisoning route. Check for signs of contamination on clothing and skin. Ask witnesses or the casualty about the type and method of exposure. 2. Remove from the contaminated environment. Transport the casualty. Use the dragging method or a stretcher to move the casualty to an upwind or well-ventilated area to avoid secondary exposure. Remove contaminated clothing. Cut off and seal contaminated clothing to prevent further skin contact. If contaminated by liquid chemicals, use a dry cloth or other absorbent material to gently wipe the affected area before removing clothing. 3. Targeted first aid measures. 1. Inhalation poisoning or asphyxiation. 1. Airway opening. Unfasten the collar and belt to ease breathing. Clear any vomit or secretions from the mouth and nose. Use the head tilt, chin lift method to open the airway. If cervical spine injury is suspected, use the jaw thrust method. 2. Oxygen supply and respiratory support. If breathing is spontaneous, administer high-flow pure oxygen. For carbon monoxide poisoning, continue oxygen supply without interruption. If breathing is weak or absent, use a portable bag valve mask to provide artificial ventilation. Avoid mouth-to-mouth breathing to prevent exposure to toxic substances. If an automated external defibrillator (AED) is available, connect the AED immediately and follow the instructions. 3. Cardiopulmonary resuscitation (CPR). If there is no pulse, immediately perform chest compressions at a rate of 100 to 120 compressions per minute. With a depth of 5 to 6 centimeters, maintain a compression to artificial ventilation ratio of 30:2. 2. Skin or eye contact. 1. Skin contamination. Rinse the affected area with running water for at least 15 minutes, focusing on hidden areas such as hair and nail crevices. 2. Eye contamination. Hold the eyelids open and rinse with normal saline or clean water from the inner canthus to the outer canthus for at least 20 minutes, avoiding direct impact on the cornea. After rinsing, cover the eyes with sterile gauze and avoid rubbing them. 3. Ingestion poisoning. Do not induce vomiting. For ingestion of strong acids, strong bases, or petroleum-based chemicals, inducing vomiting may worsen esophageal injury or cause aspiration pneumonia. Dilution. If the casualty is conscious, give 200 to 300 milliliters of milk or water to dilute the toxin. If the casualty is unconscious or convulsing, do not give fluids to prevent choking. 4. Emergency handling of specific chemicals. 1. Asphyxiating gases such as hydrogen sulfide and carbon monoxide. Immediately evacuate to a well-ventilated area. Use a self-contained breathing apparatus (SCBA) for rescue operations. For carbon monoxide poisoning, treatment in a hyperbaric oxygen chamber is required. Maintain continuous oxygen supply during transport. 2. Irritant gases such as chlorine and ammonia. In the early stages, use glucocorticoid nebulization to prevent pulmonary edema. 3. Cyanide poisoning. Immediately follow the 3-step antidote protocol: inhalation of amyl nitrite, intravenous injection of sodium nitrite, and intravenous injection of sodium thiosulfate. 5. Casualty transport and handover. 1. Preparation before transport. Continuously monitor heart rate, blood oxygen saturation, consciousness, and other vital signs. Ensure the airway remains open during transport. Record the details like name of the chemical involved, duration of exposure, and first aid measures already taken and transfer them with the casualty to the medical team. 2. Transport considerations. Secure the casualty on a stretcher and place them in a side-lying position to prevent asphyxiation from vomiting. Prioritize hospitals with poisoning treatment capabilities and notify the emergency department in advance to prepare for admission. 6. Decontamination of rescue personnel. Rescue personnel who entered the site should undergo decontamination at a pre-established decontamination station. Wear protective suits and use specialized decontamination equipment for washing. After removing protective equipment, perform secondary decontamination, focusing on sensitive areas such as the mouth, nose, and eyes. Now let's learn about chemical burns. Chemical burns involving hazardous chemicals refer to accidents where corrosive hazardous chemicals accidentally come into contact with a person, causing a chemical reaction on the exposed body surface within a short period, resulting in significant damage to skin tissues. The following are the steps for on-site first aid. 1. On-site assessment and safety protection. Follow the same handling requirements as for poisoning and asphyxiation involving hazardous chemicals. 2. Casualty assessment and removal from the contaminated area. 1. Assess the burn condition. Burn location. Examine the skin, eyes, and clothing for chemical contamination, paying special attention to hidden areas such as the underarms and soles of the feet. Burn severity. Localized redness, swelling, and pain without blisters indicate mild burns. Blisters, skin ulceration, and intense pain suggest moderate burns. Deep tissue necrosis, shock, or accompanying symptoms of poisoning signify severe burns. 2. Remove from the contaminated environment. Quickly transfer the casualty to a ventilated and non-contaminated safe area to prevent further chemical exposure. If the casualty's clothing is contaminated, immediately cut and remove the clothing using scissors. Avoid direct contact with contaminated clothing. If contaminated by liquid chemicals, gently blot with an absorbent cloth before removing the clothing. 3. Flushing and decontamination. 1. Skin burn treatment. Continuous flushing. Rinse the burned area with a large amount of running water for at least 15 to 30 minutes at room temperature. Pay special attention to hair, nail crevices, and other areas where residues may remain. Flush from top to bottom to prevent the spread of contaminants to uninjured skin. Special chemical treatment. Quicklime and sodium metal. Do not rinse directly with water. First, use a dry cloth or tweezers to remove solid particles. Then apply oil-based substances to cover the affected area, gently wipe, and finally rinse with clean water. Phenol. Wipe with 50% alcohol or polyethylene glycol (PEG 300) to dissolve the phenol. Then rinse thoroughly with clean water. Hydrofluoric acid. After rinsing, apply calcium gluconate gel to the affected area and bandage it. Immediately transport the casualty to a hospital to prevent hypocalcemia. 2. Eye burn treatment. Immediate flushing. Hold the eyelids open and flush the eyes continuously with normal saline or clean water from the inner canthus to the outer canthus for at least 20 minutes, avoiding direct impact on the cornea. Protection after flushing. Cover both eyes with sterile gauze after flushing. Do not rub the eyes or apply eye ointment. 3. Important precautions. Do not neutralize chemicals. Do not attempt to neutralize acids with alkalis or vice versa, as the resulting heat may worsen the injury. Do not apply ointments. Do not use home remedies such as oil, toothpaste, or soy sauce on chemical burns, as they may interfere with subsequent medical treatment. 4. Wound protection and initial treatment. 1. Covering the wound. Cover the burn wound with sterile gauze or clean cloth to avoid direct contact with air or contaminants. If there are clothing fibers or other residues attached to the wound, do not forcibly remove them. Leave it to medical professionals for treatment. 2. Relieving pain and shock. If the casualty is conscious, allow them to drink small amounts of saline water to replenish fluids. Use a blanket to cover and maintain warmth, preventing hypothermia. Monitor consciousness and pulse. If signs of shock appear, elevate the legs immediately. 5. Emergency handling of specific chemicals. 1. Strong acids such as sulfuric acid and hydrochloric acid. After flushing, a weak alkaline solution such as 5% sodium bicarbonate can be applied as a wet dressing, but only after ensuring thorough flushing. 2. Strong bases such as sodium hydroxide and ammonia solution. After flushing, a weak acidic solution like 2% boric acid or acetic acid can be applied as a wet dressing, though abundant water flushing should remain the priority. 3. Phosphorus burns. Cover the wound with a wet cloth to isolate it from air. Alternatively, lightly wipe the wound with a 1% to 2% copper sulfate solution, which will form a black phosphorus copper coating, making it easier to identify and remove. Casualty transport, medical handover, and decontamination measures for rescuers should follow the same procedures as for poisoning and asphyxiation involving hazardous chemicals. Alright, that concludes this lesson. See you next time.